In early 2020, a novel virus called COVID-19 reached the United States. In an attempt to contain the virus, various efforts have been taken. However, the United States still has had over 9 million cases with over 230,000 deaths.
With such a large crisis that poses a threat to our society, existing tensions between personal freedom and public welfare have come to the forefront of political debate. For example, does the United States government have the right to mandate stay-at-home orders, mask wearings, and COVID-19 vaccines if one becomes available? This controversy between personal freedom and public welfare is nothing new in the face of disease. For example, mandated vaccination for smallpox in the late 19th century sparked riots among the German immigrant population in Milwaukee, Wisconsin. When health officers went into neighborhoods to vaccinate residents, they were met by angry mobs. Clashes between public good and personal freedom can even be extended beyond infectious diseases. For example, during the 1970s, pressure from the federal government led almost all states to enact laws requiring motorcycle riders to wear a helmet. Motorcycle riders countered that the state was depriving them of their freedom to be able to cycle the way they wanted to. A court in Massachusetts found that the repercussions of not wearing a helmet reached beyond the individual and extended out to society in the form of state-provided medical services and unemployment if disability occurs. Similar to this court ruling, decisions about COVID-19 are not just an individual choice due to their effect on greater society.
Several weeks into the COVID-19 outbreak in the United States, the CDC began to recommend the wearing of cloth face masks while in public places. Many towns, counties, and states have implemented mandatory mask orders, a decision that has been met with a varying degree of compliance across the nation. Preliminary assessments show that the wearing of cloth face masks is an effective measure against spreading the virus, but not necessarily protecting the wearer. A symptomatic person without a mask can spread the virus to those around them, even if those individuals are wearing masks. A symptomatic person with a mask, however, has a much lower chance of spreading the virus. The CDC cites an example of two hairdressers in Missouri who had both contracted the virus, were symptomatic, and had prolonged contact with 139 customers during their time of infection. The hairdressers wore cloth masks, as did their customers, and none of the 139 developed symptoms in the weeks following the exposure. This shows that masks, when worn properly, can be an effective tool in slowing the spread of COVID-19. Wearing a mask is not so much to protect oneself, but more so to protect others around them who may be susceptible to infection. Laws already exist that protect vulnerable populations. For example, in California, it's illegal to smoke in a car with a child under 18 years of age. Requiring laws like mask ordinances that protect vulnerable populations are not new to the United States, and their implementation could help save many lives, making them a reasonable form of government imposition.
Along with required mask wearings, the United States government has mandated social distancing practices such as various stay-at-home orders. A 2020 study found that the government-mandated social distancing practices reduced the daily growth rate of confirmed COVID-19 cases by 5.4 percentage points after just 1 to 5 days. Obviously, from a public health perspective, separating people is an effective strategy for preventing the spread of infectious diseases. However, it can also place limitations on personal freedoms. For example, stay-at-home orders mandate that all residents stay at home unless they are going to an essential job or to shop for an essential need. Whatever the reasons for which states may place limitations on personal freedoms, it is of paramount importance that the measures taken are limited to what is strictly necessary to manage the pandemic and do not lead to the permanent curtailment of human rights.
The United States government has allocated billions of dollars to funding a COVID-19 vaccine solution. However, despite such enormous resources going to the development of a vaccine, the next obstacle may be getting enough people to voluntarily be immunized against the virus. For example, a 2020 study conducted an online survey of 2006 adults in the United States and found that only 69% of them would be willing to receive a vaccine. The study found a strong correlation between willingness to get a vaccine and perception that a healthcare provider would recommend one. This shows that if a COVID-19 vaccine becomes available, recommendations from a healthcare provider may be key in encouraging vaccine-eligible patients to receive one. Thus, one solution in helping to manage the pandemic through vaccines would be to put funding towards ads on vaccine safety and effectiveness that are endorsed by healthcare professionals.
The COVID-19 pandemic is an ever-evolving situation, but eventually a vaccine will be made available and the nation will face the challenge of delivering it to a potentially unwilling public. A vaccine would certainly curb the spread of the virus, but in the short term, as more research becomes available, trends clearly show that mask ordinances and social distancing are slowing the spread as well. All these in combination work to keep the people of this nation safer from a deadly virus, and therefore, the government should be justified in enacting some form of control over their implementation. This being said, federal laws regarding COVID-19 should not overstep those of the ones that have come before without careful consideration of civil liberties. This concept is summarized by the philosopher John Stuart Mill with his description of the harm principle, which states, "The only purpose for which power can be rightfully exercised over a member of a civilized society against their will is to prevent harm to others." Moving forward, a path must be forged that ensures the safety of the American public whilst not violating the civil liberties we hold dear. This can best be done by increasing funding for research regarding vaccines, mask effectiveness, and social distancing practices. If people better understand the ramifications of their actions and how their personal decisions affect public safety, it will be more feasible to reconstruct a healthier America, free from the need to impose restrictive health orders.